Good afternoon, everyone, and welcome to MitoAction's monthly expert series. Today, Jonathan Mortis, PharmND and CEO of Chemistry RX, and Jennifer Lundy, PharmND and Lab Director at Chemistry RX, are joining us to discuss enhancing the lives of mitochondrial disease patients through compounded treatment options. My name is Stephanie Harry. I'm one of the patient support coordinators at MitoAction and will be your host for today. Today's presentation will be recorded and available on MitoAction's website in the coming days, as well as on our podcasts, Apple Podcasts, Google Play, and Spotify. We encourage you to ask questions throughout the presentation using the Q&A feature in the bottom menu bar of your screen. If you're calling in via phone, please feel free to submit your questions to us by email at info@mitoaction.org. We will do our best to get through all of the questions today at the end of today's presentations. Numerous mitochondrial disease patients consume something known as the mitococktail. What is this exactly? How do you decide where to get components of your mitococktail, and what are the pros and cons of using a compounding pharmacy? How do compounding pharmacies work with clinicians to make sure that patients are receiving the treatments that they need? Today, Jonathan Mortis and Jennifer Lundy will help us break down these common questions. Jonathan is the CEO of Chemistry RX platform, which includes 4 503A compounding pharmacies throughout the U.S. Jonathan is a third-generation pharmacist who has practiced in many different aspects of pharmacy throughout his career. In 2011, he became immersed in compounding pharmacy services after witnessing the struggles many patients experienced when they suffered from rare and debilitating conditions, and those for which commercially available products did not provide adequate therapies. He joined Chemistry RX in 2022 as COO and moved into the CEO role later that year. His pharmacy knowledge includes clinical patient care, pharmacy operations, and provider and institutional hospital business development. Jonathan brings his mission of no patient left behind to every organization he's ever been a part of. Jennifer Lundy, PharmD, RPH, graduated from The Ohio State University with a Bachelor of Science and Pharmaceutical Sciences, BSPS degree. She then earned her Doctor of Pharmacy degree at Thomas Jefferson University. Jennifer fell in love with pharmaceutical sciences at a young age. She was intrigued with the notion that small molecules can have a large impact on physiological functions of the body. Jennifer joined Chemistry RX Compounding and Specialty Pharmacy in 2017. At Chemistry RX, Jennifer is the Director of Compounding and specializes in mitochondrial disease and metabolism disorder formulas. She works closely with physicians to create personalized mixtures of prescribed supplements unique to the needs of each patient. We're so excited to have you both here today and to learn more about compounding pharmacy. And I know that we'll have lots of questions from our audience. It looks like a couple have already come in. So without further ado, we're going to go ahead and get started. And if you guys would like to go ahead and share your screen, we're so excited for you guys to be here, and I'll let you guys take over.
Awesome. Thank you for the introduction, Stephanie, and great to be here today and to talk to everybody about compounding pharmacy and mitochondrial disease and how we play a role in that aspect of it. Just to echo a little bit of what Stephanie said, over my years of being a pharmacist, I noticed the need for more individualized treatment, specifically as it related to rare diseases. Going through retail pharmacy and then transitioning over, that was a key driver for it. And again, in joining Chemistry RX back in 2022, it was the organization's commitment to excellence in the rare disease space was a main driver of that. And I think we're doing a great job, and happy to talk to you guys all about it today. And Jennifer, you want to add anything else before we get into it?
Yeah, sure. I'll just say when I started in 2017, and that was straight out of school, the pharmacy school, I started off as a compounder even. So I really got to see Chemistry RX grow, and I got to experience all stages, like all different roles that are a part of Chemistry RX. And it's been really cool to move forward with that to the point where I am now handling more of the formulas these days. And so I hope that we'll be able to help you guys with these mitococktail questions that you have.
Thanks, Jennifer. So title of today's presentation is Enhancing the Lives of Mitochondrial Disease Patients Through Compounded Treatment Options. So when we go to the next slide, we're going to look at the differences between traditional pharmacy and compounding pharmacies. Some of y'all may know this, and some may have questions as to what is a compounding pharmacy. So when we look at a traditional pharmacy, they dispense pretty much commercially available pre-manufactured products. The medications are predominantly in fixed dosage forms, meaning they come as a tablet and that's how they leave the pharmacy, or they come as a solution and that's how they leave the pharmacy. Traditional pharmacies may do a little bit of basic compounding, but as the regulations and the environmental requirements continue to evolve and become more stringent, we're starting to see a lot less compounding being done in traditional pharmacies, and majority of it moving over into the compounding pharmacy realm. And what is a compounding pharmacy? So what we do is we create customized medications. In doing that, it allows us to have flexibility to add different ingredients or omit them. Also, the dosage forms we do, it can be dependent upon the patient's condition and how they need to take it. Do they have a J tube, PEG tube, et cetera? So we're able to adjust a lot of different medications and put those into alternate dosage forms so that we can cater to the whole audience that's out there. Also, again, commercially available products are pretty much a set dosage form, and we have the ability to navigate around that, leave out ingredients there where there may be allergies or fillers. And this slide just kind of highlights what I said, where your traditional pharmacies are pre-manufactured. There's a focus just on dispensing, a lot less compounding being done in a traditional pharmacy. Vice versa, when it goes into a compounding pharmacy, everything is pretty much individualized for patients. So we can get a prescription from a doctor that completely differs from somebody else's medication with the same disease state, or just tweaked a couple of the different doses on some of the ingredients. Next slide, Jen.
So mitochondrial diseases, generally speaking, it's a disease that affects the mitochondria, which are the powerhouses of the cells in the body, and it generally results from genetic mutations and environmental toxins. And there's been increased prevalence, particularly lately, due to better diagnostics and increased awareness. So some of the symptoms that you may see in your patients that have mitochondrial disease include poor growth, muscle weakness and loss of muscle coordination, neurological problems, including seizures. Sometimes patients will also have autism spectrum disorder. A lot of times you will see visual and hearing problems in these patients, and developmental delays. Heart, liver, and kidney disease is something that we often see too. GI disorders, a lot of our patients end up having feeding tubes that they will need to administer the mitococktail through as well. Some patients have diabetes, and that kind of plays into some of the ways that we can customize these mitococktails as well, because we can help the patients adhere to either ketogenic diets, or if they just need low carbohydrate diets, we can accommodate that as well. Some patients will have respiratory disorders, an increased risk of infection, thyroid and or adrenal dysfunction, dysfunction of the nervous system, and other neurophysiological changes. So there are several different medications that are commonly prescribed for patients with mitochondrial disease. And this includes, but is certainly not limited to, mitochondrial cocktails, which we will get into further later on. Sometimes patients will just be prescribed the commercially available folinic acid capsules, which is also known as leucovorin. Some patients will be prescribed hydroxycobalamin injectables. Right now with the hydroxycobalamin, there is a national shortage. So 503B pharmacies are able to compound hydroxycobalamin injectables at a sterile pharmacy in place of the commercially available products in the meantime, to help assist with that national shortage issue. A lot of mitochondrial disease patients will be prescribed dye-free medications, and also if they have any allergies to certain fillers or whatever other allergy that they may have, that might also be a necessity for mitochondrial disease patients. So to give you a background on mitochondrial cocktails, over the last 20 years, research options, abstracts, and articles written in collaboration by researchers and physicians from leading genetic institutional centers documented medications and vitamin supplements associated with treating the symptoms of mitochondrial disease. Genetic mutations cause disruption to the mitochondria of certain cells. Customized mitochondrial cocktails consist of a combination of various medications, amino acids, vitamins, and other supplements, and they differ from patient to patient. So individualized doses of each ingredient has become widely prescribed, and that's something that we are really strong in, and that's something that we can certainly accommodate being a compounding pharmacy. Ingredients selected for treatment not only need to be specific to each patient's symptoms, but consideration also needs to be taken regarding absorption and the patient's ability to undergo biochemical reactions in the body to convert inactive forms of these ingredients into the active forms of the ingredients. So for example, ubiquinol is a form of coenzyme Q10. Ubiquinone is also a version of coenzyme Q10, and sometimes you will see either or prescribed for patients with mitochondrial disease, but ubiquinol is the more bioavailable version, and sometimes these patients have difficulty converting ubiquinone to ubiquinol. So ubiquinol is typically the preferred form of coenzyme Q10 for these patients. Mitochondrial cocktails or mitococktails have been widely used based on the ability to individualize treatments for these patients, allowing compounding pharmacies to play a vital role to patients suffering from mitochondrial disease. Now, the principles of mitochondrial cocktails include the fact that mitochondrial cocktail is a term for a prescription of blended medications, amino acids, vitamins, and other supplements prescribed by doctors for patients suffering from mitochondrial disorders. Mitochondrial cocktails can simplify the administration process associated with complex medication regimens. And what we mean by this is that sometimes mitochondrial patients can be prescribed very high doses of a lot of different active ingredients. And so if the patient needs to try to take all of those ingredients as either prescription forms or over-the-counter forms of these medications, it can sometimes lead to an excessive number of capsules or tablets that the patient needs to take, and the pill burden can be pretty tremendous. And not only that, but also you have to then take into consideration the amount of fillers and other additives that go into these over-the-counter and prescription medications. And when taken in such large quantities, that can cause adverse side effects. The mito cocktails can be compounded into a variety of dosage forms, assisting with the required administration route of the patient. For example, we can do oral suspensions, capsules, or powders in a jar with scoops for the patients. Mito cocktails undergo an extensive process when being formulated based on each ingredient's physical properties included in the prescriptions and a multitude of patient factors. So different properties that need to be considered include solubility, which you need to consider because there's a wide range of concentrations of the ingredients in these formulations. Palatability. Each mitochondrial cocktail is comprised of different ratios of ingredients, leading to high variability in the process for making them palatable, while always adhering to all USP standards. Stability, ensuring that stability guidelines are always adhered to for patient and product safety. Route of administration. Disease manifestations can require a wide array of possible dosage forms. Allergies, for example, patients may have allergies to certain dyes. Dietary restrictions, as I kind of mentioned earlier, if a patient needs a ketogenic diet, which would require 0 carbohydrates, or if they are just requiring the low carbohydrate diet too, if the patient needs a kosher formulation, or if they have sugar or alcohol intolerances, for example. And there are many other dietary restrictions too, but that's just to name a few. Patients' personal preferences, for example, flavors. Sometimes, patients can have specific preferences when it comes to these things, and we have a wide number of different flavors that we can offer, which we'll get into later as well. Compounded mitochondrial cocktail versus commercially available supplements. It is crucial to customize the compounded mitochondrial cocktail to each patient's clinical genotype and phenotype. Usually, you have much higher doses than you can find over the counter. There will also be very specific doses for each patient that may not be found over the counter. The pill burden, as I mentioned before, when using these over-the-counter options can be tremendous. These fillers and other additives may not be compatible with the dietary restrictions the patient may have, which has the potential to cause adverse effects. In addition to incompatibilities with dietary restrictions or allergies, as I mentioned, when the amounts of those fillers get so high, you can have that GI upset or other side effects associated with those as well, including difficulty going to the bathroom, upset stomach, nausea, etc. Dietary supplements that are found over the counter do not undergo the same testing as pharmaceutical grade bulk powders do. It's just for the fact that dietary supplements are not FDA approved ingredients. They are not pharmaceutical grade ingredients, so they do not undergo the same potency testing. So you don't necessarily know that those active ingredients in those dietary supplements are the same potency as they are when we purchase them from our suppliers that we use. We have to use pharmaceutical grade powders for the mitochondrial cocktail. So you can have that level of assurance with these mitochondrial cocktails as well. The benefits of using a compounding pharmacy for mitochondrial disease include the fact that you can get customized mitochondrial cocktails. Mitochondrial disease treatment often involves a combination of medications, amino acids, vitamins, and other supplements. A compounding pharmacy can create personalized mitochondrial cocktails that combine all the necessary ingredients into the right dosages for each patient. This can simplify medication management and improve adherence. You have a lot of dosage flexibility with mitochondrial cocktails. Standardized dosages of commercially available options may not be optimal for patients with mitochondrial disease. A lot of these ingredients are weight-based, so that is one of the reasons why dosage can be so variable between patients. Compounding pharmacists can customize doses to meet individual needs. Another benefit is if a medication has been discontinued for whatever reason, whether the manufacturer is no longer able to make it, it doesn't make sense for them to make it anymore, whether due to financial reasons or supply issues for them specifically, compounding pharmacies can continue to make these different medications. So you'll see a lot of different ingredients prescribed in mitochondrial cocktails. Most often, we see ingredients that are listed here: ubiquinol, arginine, leucovorin, which is also known as folinic acid, biotin, B complex. We'll either see B50 complex or B100 complex, but more than often we see B50 complexes being prescribed. Alpha lipoic acid, levocarnitine, thiamine, citrulline, ascorbic acid, which is also known as vitamin C, vitamin E, niacin, and niacinamide, creatine, N-acetylcysteine, and riboflavin. There are a variety of dosage form options for mitococktails. The most common form that we see is an oral suspension form. It is a liquid. It is a great option for patients with different types of feeding tubes because of the ease of administration for those patients. It is also a great option for patients who have difficulty swallowing capsules. And it does happen to have a shorter beyond use date because usually these are made using water-based oral suspending vehicles. And so the medications are typically dispensed in a 30-day supply or a 2-week supply. So the beyond use date doesn't really affect most patients in that way, but it is just something to consider. The powder in a jar with scoops option is good for ingredients that are usually prescribed at higher doses, for example, creatine, arginine, and citrulline. And the reason for this is because with so much powder for those particular prescriptions, it is difficult sometimes to put it into an oral suspension because the volume of the final suspension can be so high for those patients that sometimes it's better if these powders are just left as powders that can be added to juices, milk, food, etc., whatever the patient prefers as they prefer to use it. These do also have a longer beyond use date. Usually it's up to 6 months. So there's a little bit more of a flexibility there, especially if patients are traveling. And then the other option is capsules. So these can be taken as capsules, or they can even be opened up and poured into food or drinks. And these also have the longer beyond use date up to 6 months. So as I mentioned, we have a bunch of different flavors available for patients, and they're all kind of listed here. I would always very highly recommend Hawaiian Punch for the bigger mitochondrial cocktails that have a whole bunch of different ingredients in them. The Hawaiian Punch flavoring that we make typically is the most successful at masking any of these active ingredients that have a bitterness component to them, or sometimes some patients can describe the flavor of some of the actives as spicy even. And the Hawaiian Punch really is very good at masking that. The second best option, I would say, for masking is strawberry lemonade. But obviously we have all of these different options here as well, because not every patient is going to like either of those two flavors. On top of that, you have patients that have, again, these dietary restrictions. So some patients can't tolerate dyes, and some patients have carbohydrate restriction considerations. And so we do have certain options here for those types of patients who may not be able to tolerate dyes or may need absolutely no carbohydrates in their final formulation.
Okay, thanks, Jen. So different considerations that you need to take into account when you're looking for a compounding pharmacy, either as a patient or as a provider, and you're thinking about moving into the compounding pharmacy realm for prescribing. So first off, there's limited research available as it relates to a lot of compounded medications. So when you're considering a compounding pharmacy, you want to trust that your compounding pharmacy and their staff, their clinical pharmacists are staying on top of the most recent literature that exists, because you are putting a lot of trust into the pharmacy when you move into a compounding pharmacy. Next would be the quality control. So being that compounded medications are produced in labs, it's crucial that your pharmacy invest in technology, the best ingredients, quality, and also compliance, because that's going to ensure that you get the highest quality compounds. Next would be the clinical expertise of the staff. So it's important when you're considering or selecting a compounding pharmacy that's when you need to look into the different accreditations that exist. And I'll get into some of the accreditations on the next slide. Next thing would be the insurance coverage. So because these compounded medications, there's a lot of pharmacies out there that do compounding, but there's very few out there that have navigated into the insurance world and understand how we can get these covered for patients to make them more affordable. So that's another thing that you need to consider when you're choosing a compounding pharmacy. And then lastly, the cost of them. So we just talked about insurance, but what if it's not covered? Say your plan just doesn't cover it, or one of your state Medicaid plans doesn't recognize, powders as a covered entity. So what we've done is gotten really creative, and we have affordable options for patients when there is no insurance coverage available to them. Next slide, Jim. And additional things to consider. So with insurance, with compounding pharmacies not accepting insurance, a lot of them, the cost burden for patients is quite high. So you want to select a pharmacy that's able to navigate through that and help out with patients and figure out opportunities to how we can get those covered. And then making sure you also select a compounding pharmacy that's reputable, right? You want to go through and understand what accreditations exist in the marketplace, and ensure that you're going into a pharmacy that that is part of those accreditations. Also, you want one that has open dialogue with providers. One of these mitococktails, what we commonly come across is that because bodies change over time, dosages change. So you want a compounding pharmacy that has really good dialogue with providers, so that when we do our clinical review with patients, we can understand that, and we know when things need to be changed, and we'll consult with providers on that. Also, the support groups, different support groups just like this provide support for patients, and you want a pharmacy that has a relationship with those, because we try to have an understanding of what's going on in the marketplace and how we can help patients that are suffering from mitochondrial disease. So I talked about accreditations briefly, and talk a little bit about Chemistry RX as well. So we're a pharmacy that's licensed in all 50 states. We have 4 facilities throughout the country. Some are licensed in some states, some aren't. And then one of our sites is licensed in all 50, so we can help patients with all different geographies. We also, from an insurance perspective, we take all insurances, and we have 25 state Medicaid licenses to help patients as well. We also, we have a team that works to gather new insurance contracts as needed, and Medicaid contracts as well. So that's an evolving process for us on a daily basis. We're URAC specialty pharmacy accredited. And then the next one, we're the ACHC. As far as the last time we checked, we're the only ACHC rare disease accredited compounding pharmacy in the country. And what that does is it holds us to higher standards. We have a team of clinical nurses that does annual reviews with patients in the rare disease space. And we learn a lot from them from a business standpoint and from a pharmacy standpoint, but we also learn a lot and help them communicate those things with their providers. PCAB is a common accreditation body that oversees compounding pharmacies. We're part of that. And then we have our NABP, National Association of Boards of Pharmacy, accreditation for digital pharmacy. So what's it like when a prescription is sent into the pharmacy? How does the flow work? So typically a provider will send over a prescription either verbally or by fax. We'll receive that at the pharmacy. We'll do our data entry, get all the demographics behind the patient, and then do an initial outreach. And that can be done by 2 people. It can be done by our technicians, and also done by our clinical team. And when the clinical team does that, they're going to gather a lot of health information surrounding the patient. Could be allergy information, failed therapies, or side effects that the patients have experienced on other therapies. And when we do our formulation, which occurs after that, we take all of that information into account. From there, we'll submit the claim to insurance if they have insurance. If not, we'll quote them. We'll get the most affordable option for the patient. And if we submit the claim to insurance and it rejects, the prior authorization process begins. And we understand how insurance companies work when it comes to compounds, and we'll communicate that to your providers and help them navigate the prior authorization aspect. If that fails and we have to take it all the way through to appeal with the provider and help them through that part of the process, we're happy to do that. We do it on a daily basis with a lot of our different providers and patients. Once we do that, we'll either get the claim to go through, and then we can confirm payment with the patient, and then we get that medication out to the patient. Okay, we talked a little bit about insurance. We'll go a little bit more in depth. Insurance companies, we have a clinical team, and the goal of that clinical team is to interface with patients to understand what their insurance looks like. And because we've been in the space for so long, we understand the nuances with each plan. And again, we'll work with providers and discuss that with them and try and get them into more covered products so that the patients have less of a cost burden. We also have clinical pharmacists and nurses that will help navigate any coverage gaps. Some ingredients may be covered and others won't, and we'll work with them on the formulation with their providers to help get them something that is more affordable to them. And the last point, again, educating providers on which ingredients are covered, which different bases are. So we work with them through the whole process, again, to make it more affordable for patients, because affordability usually leads to better compliance and then a better quality of life for our patients. And that's the basis of the presentation, again, we're Chemistry RX, and I guess we'll open it up for questions. And Stephanie.
Wonderful. If you can go ahead and unshare your screen, then I will try to put it in grid view. We do have some wonderful questions that are coming in, and I'm very excited to get started. So thank you so much for your presentation, and thank you so much for giving us a great basis knowledge of not just how Chemistry RX works, but how mitochondrial cocktails work. Because I think a lot of times in our community, as we get chatting, I think for patients who are also new to our community, us older folks will say, "Oh, the mitococktail, da da da," as if it's one thing, and it's not. And so it's really good to have space to kind of clarify that everybody is a little bit different and what their doctor prescribes is a little bit different. And so we're going to kind of go into the Q&A time, kind of understanding that and just hearing some reflections and questions from patients who are on the call. The first question that came in is there one type of vitamin C that is better for mito patients? I've seen ads for liposomal vitamin C. Is it worth the extra cost?
So that's a great question. I myself have not seen the liposomal vitamin C options, but it's something that I'm going to want to look into now that you're bringing it to my attention. But generally speaking, the literature that I have read does not discuss liposomal versions of the vitamin C. Generally speaking, liposomal preparations of drugs are better absorbed and can be more bioavailable. So theoretically, yes, that could be a good option. When it comes to us putting it into the mitochondrial cocktails, it would also be interesting to find out if it's something that can be billable to insurance and if that's something that is important to you as the patient, and weighing that out against all of the options and discussing it with the provider themselves too. So that is definitely something that I would want to look into.
Can you explain the science behind a little bit why liposomal is typically more bioavailable? Because I know that's something that I feel like more and more our community is seeing more advertisements for. And so I think it'd be helpful to understand why it's being marketed that way.
So it depends on the active ingredient itself. So without getting too much into the weeds of it, basically it helps with helping the active ingredient pass through the membranes of our cells. And so sometimes, depending on whether the active ingredient is more lipophilic or hydrophilic, for example, or depending on how big the molecule itself is, like I said, there's a ton of different factors that play into this, but taking all that into consideration, sometimes that may affect how well it can pass through the cells, and liposomal preparations typically assist with that and help it to get to where it needs to be.
I mean, that makes a lot of sense. I think that's super helpful too, because it sounds like that makes sense that certain molecules that would be really, really helpful for, and then that it's good to ask the question, is this really needed? And a pharmacist should be able to answer that question. So another question came in regards, you showed that nice slide about all the different flavors. And so let's say like you were talking about I think the fruit punch is really good, and strawberry lemonade is a good flavor to add to try to mask some of the other components of a cocktail. But let's say you're allergic to strawberries. Is the flavoring like close enough to strawberry that it would cause allergies, or is that not how flavorings really work?
It's going to depend a lot on the supplier themselves. So if I was presented with this type of question from a patient or from a prescriber, I would contact the manufacturer myself, and I would try to find out more specifics. They have allergen statements that are available. A lot of times they have information about the sources from where they get all of their ingredients. And so, or if it's like completely synthetic, then if there was a true strawberry allergy, then it should not, have an effect on that allergy. But that would require more digging. It's not something that you can just generally say across the board, like strawberry flavorings are going to be okay for strawberry allergy. It would be very specific to that exact ingredient and that exact source that you're getting it from.
Okay, that's super
And
helpful.
Stephanie, and don't let Jen be bashful. She's passionate about flavoring. She spent a ton of time creating all those flavorings. So Jen, if you want to elaborate any more on flavorings, I know it's one of your claims.
Yes. So for these flavorings, like I said, we have those dye issues. We have the carbohydrate issues that we're dealing with. Um, and if there are any fruit allergies as well, that is something to consider. When it comes to the dyes specifically, what I kind of want to make sure that I emphasize with patients and providers that may be listening, um, there are different dyes that patients can have allergies or intolerances to, or just may have a general preference as to whether or not they have them. And so it is always very good to know if it is a specific color dye as well that can be an issue, because if it's red dye, for instance, but yellow dye is okay for the patient, it would be important to know, because we can make a more palatable product if we're able to use yellow dye. Sometimes we'll have more options for flavoring. We'll have more options sometimes for the oral suspending vehicles. And so the more detail that can be provided, the better, because there's really so many options for these patients. And I wouldn't want anyone to have to take a product that is less palatable because they're not being like as specific enough, or, you know, just not realizing all of the options that are available. So it's an in-depth discussion that we have with patients and the providers, if the providers need to get involved with this. But yes, there's really a lot that we can talk about when it comes to that kind of stuff.
No, I mean, I'm glad that you went into that a little bit more, because I think it's important for our patient community to realize that if they have a mitococktail that isn't palatable, that they can have a further conversation about that, right? Because sometimes you don't know that you can ask the question, or that there could be an alternate solution, and or maybe the clinician doesn't realize how much you guys, can do to help with that situation. Because when you're taking a combination of all of these different vitamins, I mean, flavor is important, especially if you're consuming it every day. And so I think it's great that you focus so much on that. So hopefully it's something that patients don't have to be like dread. I think of my sister. When my sister was young, she didn't have mito, but she had chemo, and she had to take what she called the yucky stuff every morning. So it's nice if it doesn't have to be yucky, right?
Exactly.
Right. And some patients may even get tired of a particular flavor and just want something to change it up. Like, we can do that as well, too. It's better to try to minimize the number of changes that happen, because sometimes it can trigger issues with the insurance company. But generally speaking, if it's, and again, it depends on the specific insurance plan, but generally speaking, if a patient needs to change the flavor, we won't usually run into big hiccups with the insurance coverage that may already exist if we had to do a prior authorization.
Okay. And there are some insurance questions that have come in, so we'll get to those in a second. But first, I wanted to ask another supplemental question. This patient asked, when mitococktail supplements get compounded, do they end up being the same amount of capsules, or do they end up being less? For example, if you're currently taking 4 capsules 4 times a day, if it was compounded together, would it still be a total of 16 capsules a day? And there was an other patient, and I will try to relook at her question to make sure I don't miss anything, but she also mentioned like she's taking 40 capsules a day, and she's trying to see if she can minimize that amount as well.
So my assumption is that this may be, like, for this first example that you read off, 4 capsules 4 times a day, that more than likely it's not just one ingredient, and it might be multiple different capsules that they're taking 4 times a day of, different active ingredients. In
Yes.
which case, typically, yes, it's going to be a fewer number of capsules per day. It also depends on the size of the capsule or tablet that you were purchasing over the counter or via prescription, because we can put these into bigger capsules. And so if you can tolerate larger capsule sizes, but would prefer a smaller number of capsules that you have to take, then that would be one way to do it as well. But for the patient that's taking 40 capsules, mm-hmm. I would say that yes, more than likely we would be able to either knock that down to a smaller number of capsules that you'd have to take, or if you were to consider an oral suspension, there's a good chance that the volume may not be super overwhelming. And again, it totally depends on the specific components of the mitochondrial cocktail that you're taking, but more than likely the majority of what you're consuming via all of those capsules that you're taking is filler.
So this kind of brings up the question of insurance. At the end of her statement, she asked, "My question is that since all these vitamins are over the counter, do I really need to have a doctor's prescription?" And so, can you explain a little bit, and maybe this is a Jonathan question, as to like why patients need to have a prescription in order to do compounding pharmacy when a lot of these supplements maybe are over the counter?
Yeah, I think I'll start it and then let Jen take it. So everything that leaves our compounding pharmacy, everything that we compound needs to be pursuant to a prescription. So we need to get a prescription for it, regardless if it's a vitamin. And then also, Jen might talk more on this as well. When we increase the strength of a vitamin, sometimes it actually becomes a prescription product. At a lower dose, maybe something considered over the counter, but as we if a patient needs a higher dose of it and we compound it into something, it actually is prescription grade at that point. Jen, you want to grab the second part of that?
Yeah, what was the second part of the question? Was there more to the question that John? No.
I thought there was more to it, Stephanie.
Oh, no. It's the question as to why do you have to have over-the-counter supplements? Why do you have to have a prescription for them for compounding pharmacy? So did he cover it all, Jennifer? Do you think we need to add anything else to what Jonathan shared?
He basically did cover it. So what he's trying to say is that and he really did say this, but regardless of what the ingredient is that we're compounding with, if we are making a compound for a patient, that compound needs a prescription. You also have to have a prescription if you're going to try to put anything through the insurance, whether it's a compound or not. So if you wanted to try to pursue insurance coverage, that would be another reason why you would need to have a prescription, regardless of whether you were getting a compounded product or not.
Oh, and how long does that normally take to get compounded pharmaceuticals through insurance, like prior authorization? Like, does that, typically take months? I mean, it's amazing that you guys help patients with that process, because I've been on the other end of trying to get that process done, and it's exhausting as a patient to work through prior authorizations. But does this delay therapies, or are you able to work with patients while the prior authorization is going through? How does that normally work from your end?
Yep. So Jen, how about this? I'll start with the first part. Maybe you grab as far as, what we can do in the meantime when someone's waiting. So when a prescription comes in and we begin that process along with the provider, as far as we pretty much liaison with the provider, they have to do what they need to do because that's what the guidelines are. But, we'll work with them to gather the necessary information and we'll submit the claim. Sometimes, it's a basic prior auth that we can get and it's a short period of time. Other times they'll reject it once and twice through two different processes. And we have to take it all the way through appeal. And we'll do that with the patient and with the provider, relaying all the information. Again, the provider does do the bulk of it, but we do work with them on it. And that can take a little bit of time. It's the process. But the beauty of it is once we do get them to a successful point, there's usually 6 months or 12 months of an authorization there. And then once you have that authorization in place and it expires, there's a good basis for them to reapprove it when we let them know, when the insurance company's notified that it's expired and we need a new one. Jen, you want to talk a little bit in the meantime, what we can do, how we service patients in the short run?
Yeah, sure. I also just kind of wanted to give a little bit more insight in terms of the turnaround time for that insurance process, because there again are a lot of different variables that play into it. It's a lot of communicating back and forth between the insurance company, the provider, the pharmacy, et cetera. But I will say that insurance companies will typically ask for up to 30 days to review an appeal. And so this is because they have clinical reviewers and clinical pharmacists that are looking over the literature that gets submitted, the chart notes from the patient's visit, and the letter of medical necessity, and all of that combined to make sure that they're making an appropriate decision for that specific patient. And so they do ask for up to 30 days. It doesn't always take that long, but that is why sometimes it can be a bit of a waiting period before we're able to get a final determination from the insurance company, especially if there is a second level appeal option, for example, or higher. And then in the meantime, we are always more than happy to dispense the medication out of pocket if the patient would prefer not to wait for the medication to be covered by insurance. If they need to get it started as soon as possible, it's always an option. So the patient does not have to wait for insurance if they do not want to.
So while we're on the topic of insurance, there's been questions that have come in about Medicaid, Medicare, and then Medicare Part D specifically. Have you guys had any success with getting coverage for Medicare Part D? And then I guess every state's different with Medicaid and Medicare. But maybe you could talk generally a little bit about what some of those processes are like working with those specific kinds of insurances.
Yep. So Medicaids, a lot of the state Medicaids they're pretty friendly because they realize why the patients are now in Medicaid because they do have a chronic debilitating condition. So they do recognize it because they understand there's a cost avoidance associated with patients getting on therapy and having a good quality of life. Unfortunately, Medicare Part D does not they don't reimburse on compounds, so that kind of is where it falls through the cracks. But again, for children, Medicaids are very friendly, and even with adults, at times we're able to help them as well on Medicaids. Jen, anything you want to add on that side?
No, I completely agree with you. Medicare Part D, we have had no success with. They're very, very strict about not approving, unfortunately.
What about out of the country? Like, do you have any ability to service Quebec or parts of Canada?
Yeah, unfortunately, we're not allowed to ship into Canada. We do have patients that come from other areas to some of the institutional hospitals that we service. And when Jen was talking about the different dosage forms, she talked about the bulk powder, how we can send it out with a scoop and they can combine it with food and drinks. So a lot of our patients that do come over, I mean, we have patients that come over from Dubai to CHOP, Children's Hospital Philadelphia, and when they come over, they'll bring back 6 months worth of the powder so that they can continue their care when they're there. But unfortunately, we're not allowed to ship outside of the country.
So if your doctors are in the States and you happen to come to the States with
You
like,
can you can get it. Yeah, you can get it.
okay,
You can bring it back, but unfortunately, we cannot ship out of the country.
okay. No, that's
Now,
helpful. That's helpful to know.
but can a caregiver of a patient get it or a relative of a patient and then they send it out? That's a different story. But the pharmacy cannot dispense. We can dispense to a caregiver, but we cannot dispense to the patient outside the country.
Okay. How often do you see patients having to redo the prior authorization process? In this particular patient shared, it seems I end up having to redo mine every 2 to 3 months for the same prescription, and it's always stressful having to expedite everything because they deny it and make us appeal. This is specifically for hydrocortisone for primary adrenal insufficiency. Is hydrocortisone something that oral hydrocortisone, is that something that you guys compound or work with even?
Jen, I'll let you grab both those if you don't mind.
No, time. So, yeah, we can certainly compound something. We can start for the hydrocortisone if the patient needs us to. But typically, I would say that the prior authorization approvals that we see are usually 12-month approvals. There are very rare instances where the insurance company will give a short-term or conditional approval that maybe even as short as a month, but it may just be because they need more information. I myself have not seen any plans that only approve the medication for 2 to 3 months, and it's just like a consistent thing that needs to be done every couple of months. I would want, if I were that patient's pharmacist, I would want to contact the insurance company and find out exactly why that is happening to see if maybe there is additional information that they need.
That's really helpful.
Yeah, three months is very atypical. Every 3 months is
Yeah,
very
that's
atypical.
exhausting. And when you're struggling with energy and you're having to go through that every 3 months, I mean, that's a lot. That's a lot. So some of our patients have been on mitococktails for quite some time, right? And for those patients, 20 years ago, they obviously struggled a lot with getting things like ubiquinol and vitamin C and NAC covered at all by insurance companies, right? So like by this point, they might have given up and think it's never going to get covered. But at this point, compared to maybe 20 or 10 years ago, do you find that insurance companies are a little bit more apt to work with a compounding pharmacy for components like ubiquinol, vitamin C, and NAC?
Yeah, I mean, what we see is there's it's crazy to say this, right? Because it's insurance, but we see expanded coverage happening in the mitochondrial disease space, and I think a lot of it is due to increased incidence and probably due to increased or better diagnostics associated with it, and also awareness. So we are seeing increased expansion as far as coverage goes. So I think if somebody's been on it for a long time and they haven't tried for 10 years, yeah, I think there's a lot of supportive literature that's newer to where insurance companies are recognizing it.
And it sounds like you guys are willing to kind of help them through the process. So like if you're a patient and you're wondering like, will my insurance cover it? I'm not really sure. Like, is this compounding like pharmacy for me? Like, how does this work? Like if they reach out to you guys, then you'll be able to help them kind of sort through some of that, like what will be covered or what won't, or how much it will cost. Like, is it cost effective or not?
Yeah, we'll help them navigate that. We gather a lot of information and we have open dialogue with our providers, and we'll help with the providers because we have a lot of knowledge on both sides, right? We've gotten a lot of info from the patient. We also have a lot of know-how on obviously on the chemical side and the billing side of it. So we can work with the providers and kind of tee everything up for them so that they can put together the prior authorization packet and submit it. And then upon a denial, we can help them through the appeal as well. The provider at the end of the day does have to do the work per the guidelines, but having that liaison and the clinical liaison, which is our clinical nursing team, be a part of it, it's an added bonus.
So what exactly does your clinical nursing team do? Can you speak about that a little bit?
Yep. So they do the initial outreach on a lot of our rare disease medications. So they speak to the patients because remember, when we formulate a formulation, we want to take into account anything that they failed on or anything that just didn't agree with them from either an oral absorption or GI distress. So all of that we need to understand before we actually give it to Jen and her team to build the formula behind it.
That's
So they
great.
interface with the patient early on in the process. And then once we do that and we determine if there's a prior authorization needed, that's when they get involved and communicate directly with the provider's office, the clinical nursing team. And they have that open dialogue with them to help speed up the process because we know what's needed. We know we know what's going to fail. We know what's going to help. And we'll work with the provider to help get them down the right path to hopefully speed up access to care.
Okay.
Um,
Oh,
Real
go
quick,
ahead.
I had an additional thought for the person that was asking about the ubiquinol, vitamin C, and acetylcysteine. So if certain patients are trying to get those ingredients covered as separate medications, whether they're supplements or prescription versions of those ingredients, if sometimes I will see if you try to submit those to the insurance separately, they won't always recognize, the insurance companies won't always recognize them as part of a mitochondrial cocktail. And so I think with the increased awareness over the years about mitochondrial disorders and using mitochondrial cocktails as like a treatment for these disease states, they will recognize it more if they are combined and put into one compounded version of the mitochondrial cocktail. And they are sometimes more likely to approve that versus an over-the-counter form of the medication. So that would be another reason why I would suggest reaching out to a compounding pharmacy to see if they can try submitting it as a compounded mitochondrial cocktail if they
Yeah,
were not
Stephanie.
previously.
Yep, because Stephanie, I mean that combination leads to better compliance, and when the better compliance leads to better outcomes. So again, that's pretty much the key behind the whole cocktail, right? And the why.
Well, and it makes a lot of sense too, because, like you guys discussed earlier, if it's, even though it's over the counter, you're consuming so much fillers if you're taking, I don't know, like if it takes you 4 pills to get the amount of vitamin D that your doctor wants, right? But you're really at a therapeutic dose. And so like if it gets to the compounding pharmacy, then you guys are kind of able to prove that. Whereas when you just go to the checkout, there's no way to like validate that. So I think it's helpful. And what you said too, Jennifer, about awareness and that's been helping to get maybe more coverage. The patient that originally asked about Medicare Part D coverage, they're curious if there's any effort to change that for those who are on Medicare Part D to be able to move that needle a little bit so they can have coverage of their cocktails too, or if you guys kind of know if there's any efforts of change going on in that area right now.
Yeah, the Medicare Part D world it's vastly different than every other type of insurance out there, and a lot of it's rebate driven and list price driven, and that's how everything's negotiated on that side. We're not using a lot of commercially available products when we're compounding, right? We're using a lot of API, active pharmaceutical ingredients, highly concentrated stuff that we're weighing down to achieve the desired dose. And because it's not a commercially available product with a rebate structure, which is what Medicare D is looking for, it really, I wouldn't foresee it coming in the near future, unfortunately.
One of the things that I've been working on for quite some time, unfortunately, is there is a legislation called the Medical Nutrition Equity Act, and so we've been pushing for insurance companies to cover the costs of not just medical foods, but also medical nutrition, including some components of the Mito cocktail. And so the positive thing I think through that is that hopefully there has been some more understanding in regards to mitochondrial disease and the conditions and the importance of that. And so, but it does take a long time, and I mean, it's been 15 years and we're still working on this legislation to get it passed, right? Like,
Yeah.
so just to provide encouragement, for whoever asked that question, that there are absolutely, there's space to like create encouragement there, but it is absolutely a battle. So, but we appreciate our compounding pharmacists who are working so hard too in the appeals process and trying to get these items covered. Um, just a couple more questions. There was a question that came in and was asking, what does it take for pharmacies to become accredited? You mentioned that accreditations lead to higher standards, but what does that process look like for accreditation?
That process is the governing bodies coming in and pretty much living in your pharmacy. Sometimes it can be 4 or 5 days. Sometimes it can be 1 or 2 days. It depends on the accreditation. There's a means of establishing the accreditation, right? Your first go through, and then on your reaccreditations, that's where they come back in and want to see all of the documentation for everything that you said you were going to do once you were accredited to the point of reaccreditation. But again, it holds us to higher standards, and for me, running a large business, it allows us. It takes a lot of worry out of the equation, right? Because I know for our accreditations, we're following all these steps, and because we're continue to go through the reaccreditation process, that everything's happening in real time. It also it pretty much forces you to have a strong compliance department, which again provides safety to our patients and the environment. It's an intensive process, but again, it holds us to higher standards and kind of gives us a good support that we're doing everything the right way.
So one last question, kind of from two different perspectives. Let's say I'm a clinician and I'm listening, and I want to be able to get in touch with you and start the process of creating like um, having my patient's mitococktail be, at your compounded pharmacy. Like, how do I go through that process? But or let's say I'm a patient and my doctor has given me, I want you to take these 5 supplements, but I don't have a prescription for them. And now I've heard this presentation and I'm like, huh, I wonder if I can, like, how do I broach that topic with my doctor? Because obviously they have to write the script in order for it to get to you guys. So if you can explain that and maybe what institutions you're already working with.
Yep. So there's a couple questions in there. So as far as if I'm a provider and I want to get more information on how to, get affiliated with Chemistry RX and start prescribing there, on our website, there's a more info field where they can go on landing page to submit their basic question. And either myself or our chief scientific officer, sometimes Hootie, who's not on this, or Jen will reach out to the provider and give them an understanding of what the process looks like, and we'll get them all set up so they can begin prescribing. If you're a patient, you can take that same route as well. Let us know that you have, a need for a mitochondrial cocktail prescription. Leave your number on in that landing page, and one of our pharmacists or technicians will reach out and kind of start you down that process as well. And as far as it relates to the institutional hospitals that we work with, we've talked about CHOP a couple of times, University of Michigan, Nemours, UCLA. We stretch across the whole country. We deal with organizations such as Mito Action. We attend a lot of the annual summits that are specific to mitochondrial disease. And then, in doing that, you meet a lot of the top researchers and prescribers out there. And I think we've kind of built up a strong foundation in servicing the community.
Well, thank you guys so much for all of your expertise, for sharing your knowledge and wisdom with us, and for taking the time to answer all of our questions. If anybody has a question that wasn't answered, or if you're watching this video after the fact and you're like, oh no, where do I go? Feel free to email me at sharry, HARRY, at mitoaction.org, and I'll make sure that you get connected in the right place. And one of the things that I really love about what you guys mentioned is how you will walk patients through the process, because sometimes, especially when you're dealing with the insurance industry, you're battling so much by yourself. So it's nice to know that, like, okay, there's going to be a set of team of people that I can work with that's going to kind of help me figure out the whole process. And so we really appreciate you guys and all that you're doing for our patient community.
Awesome. Thanks for the opportunity, Stephanie. I appreciate it.
Have
Yeah,
a
thank you
wonderful,
so much, Stephanie.
absolutely. Have a wonderful day.
You too.
Take care. Bye bye.
Bye.
Bye, everyone.